Chronic kidney disease, CKD, has silently climbed the ranks to become the ninth leading cause of death worldwide in 2023, claiming 1.48 million lives. But here's where it gets even more alarming. This rise comes despite advancements in treatments designed to slow its progression. So, why is CKD still on the rise, and what does this mean for global health? Let's dive in. By 2023, a staggering 788 million adults aged 20 and older were living with CKD across 204 countries and territories, a dramatic increase from 378 million in 1990. This surge pushed the global age-standardized prevalence of CKD from 3.5% to 14.2%, solidifying its place among the top 10 causes of death. But it doesn't stop there. CKD also ranks as the 12th leading cause of disability-adjusted life years, DALYs, with a rate of 769.2 per 100,000. High fasting plasma glucose, BMI, and systolic blood pressure are the primary culprits driving these numbers. Patrick B. Mark, MBCHB, PhD, of the University of Glasgow, emphasized during the American Society of Nephrology Kidney Week, "We've moved from being the 12th to the 9th leading cause of death globally." This confirms CKD as a major health issue. The findings, published in The Lancet, highlight a troubling trend. Even with evidence-based therapies to slow CKD's progression and reduce cardiovascular mortality, the disease continues to escalate. Why? That's the million-dollar question. In an accompanying commentary, Valerie A. Lewix, MBBCH, PhD, MSc, and Ifeoma I. Alasi, MBBS, MSc, called for urgent action. They urged the global nephrology community to raise awareness, integrate CKD screening into primary care, and support clinicians in implementing guideline-directed therapies. But here's the controversial part. Are we doing enough to address the socioeconomic and geographic disparities that make CKD a silent epidemic in certain regions? Most CKD cases fall into stages 1 through 3, with a combined prevalence of 13.9%. Older adults, however, are more likely to experience severe stages. Interestingly, the prevalence of dialysis and transplant treatments rises with age but declines among the oldest populations. High-income areas dominate in providing these treatments, while regions like Sub-Saharan Africa lag far behind. China leads the pack with 152 million CKD cases, followed by India with 138 million. The U.S. reports 38.3 million cases. Regions like North Africa, the Middle East, South Asia, and Latin America bear the highest burden. Iran, Haiti, Panama, and Nigeria are among the countries with the highest age-standardized prevalence. Researchers point to vascular risk factors and genetic variants like APOL1 as drivers in regions like West Africa. But here's another layer to consider. Could climate change, heat stress, and extreme weather events be exacerbating CKD in vulnerable areas? It's a provocative thought that demands further investigation. Globally, dialysis is more common than kidney transplants, but this gap widens in regions like Southeast Asia, Latin America, and the Middle East. Sub-Saharan Africa, meanwhile, has alarmingly low access to both. Even without kidney replacement therapy, CKD stages 1 to 5 are a significant risk factor for cardiovascular disease, contributing to an estimated 11.5% of CV deaths worldwide. The study, which drew data from literature, vital registration systems, and household surveys, used advanced models to estimate CKD burden. However, Lewix and Alasi noted limitations, such as missing albuminuria data in certain regions. Accurate data are essential to inform policy, they stressed, calling for intensified efforts to collect comprehensive data from underserved areas. So here's the question for you. With CKD's rise to the top 10 causes of death, what steps should governments, healthcare systems, and individuals take to combat this growing crisis? And more controversially, are we overlooking the role of environmental factors like climate change in CKD's spread? Share your thoughts in the comments. Let's spark a conversation that could shape the future of global health.